The next one is by Dr. Brendon Hale. He's a senior research scientist at UNITEDHEALTH Group. He leads a research team that is looking at applying VR in the field of pain mitigation and behavioral health. I'll let Brendon go into details, but I just think it's fantastic that a large organization like UNITEDHEALTH Group is stepping up and saying, we're not just going to step back and watch, we're going to get involved. We're going to move the needle and help groups move forward into this very exciting field. And I think given their position in terms of having access to information, will help move things forward so tremendously. So I think very impressed and very much enjoy working with Brendon and his team, and so much looking forward to hearing your presentation.
Thanks, Walter. It's an honor to be introduced by Walter. Not only is he a trusted mentor to myself and my team, he's also the leader, in my opinion, in VR. And so it's always a pleasure, Walter, and it's a pleasure to work with you. As Walter said, I lead the digital therapeutics research team here at UNITEDHEALTH Group Research and Development. And throughout the day, we've heard about the fantastic uses of VR in the healthcare system, and we're fully well aware of using VR for things like provider education and allowing providers to practice surgeries and or procedures in VR before actually having to perform them in the clinic. And then there's great things that Hoag is doing with the Nurture VR program. It's a really exciting use case, and Robert, I'm excited to follow that, and we'll follow with interest, I will say. And as Walter said, our digital therapeutics team has a particular interest in ensuring that we can scale VR and scale XR therapies. We believe in these technologies because we know that these technologies can deliver care to patients where they are and when they need it. Additional to that is the fact that it can enable or support care in clinics. And so the broad applicability of these technologies throughout healthcare are really important. For an organization like UNITEDHEALTH Group, it's incredibly important for us to think about scale. Next slide, please. And a little orientation to who we are as UNITEDHEALTH Group. UnitedHealthcare is a healthcare coverage and benefits organization that covers a little bit more than 52 million lives currently. Our partner corporation, Optum, is a care delivery and health technology company. They are currently working with 4 out of 5 United States hospitals. They work with greater than 67,000 pharmacies. They employ greater than 100,000 physicians and work with greater than 100,000 healthcare facilities around the nation, and they are actively involved with delivering care and or health technologies to 3 of 4 health plans. That's a pretty large scale. So when we're thinking about XR and thinking about VR, when we speak of scale, we speak of this. And so in going back to Aaron Ghani's comment at the end of the previous conversation about there's 50 million pain patients, there's another 25 million out there. This provides a little bit about a scale. However, we here at R&D have a specific mandate. And next slide, please. And so at UNITEDHEALTH Group Research and Development, we essentially sit between Optum and UnitedHealthcare. And our goal is to track and promote scientific and technological advancements in healthcare. As we've heard throughout the day today, VR represents one of those technological advancements that is really going to move healthcare forward. We are also tasked with building technologies, capabilities, and programs that will improve our members' health at scale. We also work to establish the long-term strategic direction for UNITEDHEALTH Group in general. What we have here at UNITEDHEALTH Group Research and Development are 600 plus researchers. This includes 40 PhDs across multiple disciplines. We internally refer to those disciplines as focus areas. And we have 11 focus areas within our shop that specialize in specific aspects of healthcare. We have 10 doctors and pharmacists. We have 400 plus data scientists and engineers, And we also have full-scale pilot operations and logistics to support all of our research work and work with the partners that Walter described previously. What we're really interested in doing is using repeatable components to prevent, detect, and intercept disease. Within our environment, we really want to specifically look at how can we utilize VR to prevent, detect, and intercept disease. And VR provides us a unique capability to not only gather data about an individual while they're undergoing a VR experience, but then also connecting to their data, whether it's their health or care history. We can also attach biological sensors. We can look at genomics data, proteomics data, and utilize that to help us customize care. We have teams dedicated to AI and math and building statistical models to tailor individual recommendations. We bring to bear clinical expertise so that the best teams in each specialty and apply that expertise to each member's unique needs. Lastly, we look at plan design for network and benefit structures that can drive healthier decisions. So as an organization, that is our goal, and this is how we go about executing that goal. My personal mission within this and my personal task is to specifically think about digital therapeutics and specifically XR technologies, and how do we realize this vision with XR technologies. Next slide, please. So a little bit of a definition here. We are looking at digitally mediated therapeutics. Virtual reality is steeped in that digital mediation. The key to this is that we want the user or patient to be originating the signal. And the key component of this is the ability to create experiences which require condition-specific actions by the patient that will serve as the key ingredient or the key digital ingredient to our understanding of their condition and their behavior. Importantly, as we think about this, we want to think about what are the digital signals that are being generated in the VR experience that we can use to better triage, better diagnose, and or deliver better therapy to the individual. Important in this is the idea of feedback loops, and feedback loops will continually allow us to improve someone's health as we adapt the experience based on the feedback that we're receiving from them. There are two ways we can think about this. We can think about this in terms of performance-related feedback that is delivered based on the user's generated signals within the virtual reality experience, or we can think about physiological feedback that is provided from wearables or additional sensors that are attached to the individual. Critical to this is that feedback enables personalization of the therapy. And the reason we believe it's so important to deliver personalized therapy is that we believe that all digital therapeutics need to be patient-centered. And what we really mean by that is that the design and the interface need to focus on the patient. Well, that should go without saying. We want to emphasize that this is slightly different than your usual digital health product in that the patient is the center, the patient generates the signal, and the virtual reality experience should respond to the signals generated by the patients. What we want is that the VR experiences should generate a condition-specific signal resulting from required specific condition actions that are related to their therapy so that we can better assess their progress. We can reflect the progression of their condition and or assess their current health status to better mediate or to better deliver future therapy. We also believe that these digital therapeutics should have validated effectiveness. As we think about the validated effectiveness, what we're really concerned about here is that we can show that the instantiation of the therapy that is, or the model of therapy that is being used in the digital therapeutic specifically works within that modality. It's not enough to say that a specific modality worked in in person, and so now we're going to transfer that modality into virtual reality and have it be the same. We need to generate the evidence for effectiveness of the therapy using the technology that the user is engaging with. And lastly, we would say that a digital therapeutic needs to have a programmatic capability within it, and what that programmatic capability is really the fact that there needs to be experiences developed in such a way that the user should be specified in the events that they should undertake and in the actions that they should take, and those should lead to better health outcomes or better therapies. Next slide, please. A specific example of this is in what we call Brain First Health. And as we approach Brain First Health, we look at the patient status. And what we want to do is assess patients along a continuum. And I don't remember who it was in the previous talk that it addressed patient status along a continuum. But really, we think that VR therapies and VR can apply to patients along the entire continuum, from optimal health to suboptimal health to mild functional impairment and or significant functional impairment. The key here with digital therapeutics and the key with virtual reality is that we should generate the signals that will allow us to understand what a patient's status is, what the progression of their status is, and how to deliver interventions or actions that can lead them to the next most optimal or most improved status that we want them to believe. A way to think about this is across care levels, which would be maintenance care, which is somebody who is more or less in optimal health status. They can engage in activities, engage in virtual reality experiences that are maintenance. That can be short form experiences or long form experiences that would activate neural networks, for example. Things that will encourage brain health and support the maintenance of good brain health in this specific example. In individuals that have suboptimal functioning, we want to guide them to first self-directed care, and that self-directed care will enable them to choose activities, choose experiences, choose educational opportunities that will support their knowledge, support their practice, and hopefully result in them reversing their progression along this health continuum and getting back towards a level of optimal functioning. As we move up the patient status continuum, there's obviously applications for virtual reality and clinician assisted and clinician directed efforts. Specific to those are the idea that we can enable social interactions, we can enable group therapy, we can enable adjunctive therapies that will work in between clinician-directed sessions. There's many different applications here for virtual reality, and we see the strength of utilizing virtual reality the entire way along the patient status continuum, knowing that what we're going to do is be able to realize early detection, be able to utilize the signals generated from the virtual reality experiences, from the connected biosensors to deliver personalized and or predictive and do predictive modeling to deliver better therapy. We can support lifestyle changes. We can support different behavioral activities. We can optimize what the care team is doing. We can support what the care team is doing with virtual reality. All of that should lead us to a place where we can utilize virtual reality to deliver effective therapies. In this case, effective brain therapies as we address stress and other chronic diseases associated with stress. So this is an example of how we think that virtual reality can support a care model, as well as supporting growth of providers' capabilities to enhance care and deliver care where care is needed and support a continuum of care for patients. Next slide, please. Next slide. There we go. One of the key characteristics here, and one of the really interesting things that we believe virtual reality can provide, is that virtual reality can work in an indirect way by guiding lifestyle changes that will ultimately affect health outcomes. And one of the interesting things that we can do with virtual reality is that we can immerse individuals into settings in which they have to make lifestyle choices, and they can see what the outcomes of those lifestyle choices are in very short order. We would refer to this as an indirect or a behavioral feedback loop. The advantage of being able to immerse a patient in a world in which they have to make health decisions is that we can provide them the opportunity to make those decisions and realize the impact of those decisions far sooner than they would realize them in real life. Somebody making bad dietary decisions today might not realize the long-term effects of it, but in a virtual world, we can speed that process up and provide them that feedback much sooner. We also believe that there's a direct effect feedback loop that will improve health directly by working on essential physiological and neurological processes. We believe that these have particular relevance in chronic pain, in attention disorders and stress disorders, whereby we can reinforce neural networks, attentional neural networks within the brain through repeated participation in experiences that will specifically activate those neural networks. That is a very high value opportunity as we think about being able to immerse somebody in a world, focus the therapy on a specific network or on a specific neural activation, and be able to reinforce that and support that. That should lead to and will lead to health as a direct result of immersion in the VR experience. Next slide, please. And lastly, the feedback loops also have to support the entire healthcare system. We want feedback to be provided to the caregiver or to social support networks such that the patient data can inform caregivers, helping them to improve care. We want these feedback loops to provide doctors with patient health data so they can more consistently see what's happening with the patient outside of care, outside of the clinic, and then we can adjust care accordingly. Lastly, we want to be able to use these technologies, and VR is a particular rich technology, to inform learning systems so that we can use the information to continuously learn and improve healthcare system performance. With that, I will close. And next slide. And thank you. Thank you, Walter. Thank you, Robert. I appreciate the opportunity to talk about where we see there is value in virtual reality throughout the use of it throughout healthcare.